Hi everyone, my name's Chelsea and I'm one of the vets here at Vet for Life. Today I'm going to be talking to you about feline lower urinary tract disease, also known as FLUTD. So what is this? FLUTD is a term used to describe conditions that affect the lower urinary tract in cats. This includes the urinary bladder and the urethra. The urinary bladder collects urine produced by the kidneys, and this urine is expelled from the bladder via a small tube called the urethra. Symptoms of this disease include difficulty urinating. So you may see your cat obviously straining to pass urine, looking really uncomfortable. You may see signs of painful urination. Once again, the straining to pass urine. They may also vocalize. You may also see increased frequency of urination, so jumping in and out of the litter tray, or if you have an outdoor cat, them coming in and out of through the door. You may also see blood in urine, over grooming, which can also be a sign of pain, particularly in the abdominal area. They may be urinating in inappropriate places, or they may have some behavioural changes. So what causes feline lower urinary tract disease? Depending on the age of your cat, there are many different causes. In cats under 10 years old, the main cause is idiopathic, which means that there is actually no underlying cause for the symptoms that we see. This occurs in around 60 to 70% of reported cases. Another cause is uroliths. These are stones that are found within the bladder and or the urethra, and these account for 10 to 15% of reported cases. You can also get urethral plugs. These are caused by an accumulation of proteins and cells that are normally found in the urine, which form a plug that cannot be passed. In cats, they have a much narrower urethra, and this plug can cause a blockage and result in an emergency. You can also get tumours affecting the bladder and the urethra, and the most common cause in cats older than 10 years old is a bacterial infection. As I said previously, the most common cause is feline idiopathic cystitis, so there are no known cause for the clinical signs. This describes inflammation of the bladder, similar to that seen in cystitis in humans. There are a couple of risk factors that will increase the chances of your cat getting this disease. Persian cats seem to be more affected, cats between 2 to 6 years old, neutered cats, obese cats, less active puddy cats, and being fed a dry diet, and cats that seem particularly stressed or live in a more stressful environment. So this could be multi-cat households where there's competition for resources, or it could be a very busy household with young children or people coming in and out and builders, etc. One thing to really remember with feline idiopathic cystitis is that reoccurrence is common, and around 39% of cases will recur within 8 months. So how do we diagnose and treat feline lower urinary tract disease? Treatment depends on the cause. As I mentioned earlier, there are many types of feline urinary tract disease, and depending on which one your cat has will depend on the treatment. Usually we do go by this rule of thumb. Young cats showing signs for the first time, we'll give them a full physical exam, we'll palpate the bladder to check it's not distended and uncomfortable. This is particularly important in male cats. As I said earlier, their urethras are much narrower and they can become blocked. If the bladder is painful and distended, it's likely your male cat is blocked and will need emergency treatment. We may collect a urine sample. The mainstay treatment is pain relief, increase water intake, and resolve any causes of stress that could have caused a flare-up. We usually expect these to resolve within 4 to 5 days, but if not, we may need to do more investigation. In young cats with reoccurring signs or signs that never fully resolve, we will collect a urine sample to check for infections and crystals. We may want to do further imaging, such as ultrasound or x-rays, to look for any stones present, and we may also need to take a blood sample. In older cats, so this is cats over 10 years, we rule out any underlying diseases that could cause these signs or contribute to the cat having these signs. To do this, we need to take a blood sample. We also collect a urine sample directly from the bladder if your cat has a large enough bladder at the time. This is through cystocentesis, where we use a large needle to collect urine directly from the bladder. This isn't particularly painful for the cats, it's just like a small needle prick, and they usually tolerate it very well. We check for other causes that may be affecting your cat's ability to urinate normally, such as in older cats, they may struggle to get in and out of the litter tray because of arthritis, and further imaging may also be required. So, my cat's results have come back clear. What now? So if your results have come back all clear, your cat will be likely diagnosed with feline idiopathic cystitis. There are several lifestyle changes we recommend to help reduce the risk of flare-ups. As I said before, this disease is highly associated with stress, so we need to reduce the amount of stress your cat experiences as possible. You can do this through multiple ways. Ensure your cat has many safe places they can hide when they are stressed. In a multi-cat household, reduce competition for resources. You can do this by increasing the number of litter trays. We recommend 1 litter tray per cat and then an extra one. Make sure you have separate resources for each cat, preferably in locations where the cats can use them without being seen by other cats. We recommend playing with your cats regularly and providing multiple toys for them to enrich their environments. You can also try products such as Feline or Pet Remedy that contain natural substances that help your cat feel more relaxed. Another big aspect of this disease is litter tray management. We recommend you regularly clean litter boxes. Avoid putting the litter boxes in busy or noisy areas. Cats particularly like fine clumping litter, so ensure that that is the type you are using, and make sure the litter is 3 centimetres deep. Please avoid perfume litters and litter tray liners, as your cats may not like them, and it may cause them to not use the litter tray as frequently as they should. Also, make sure the litter tray is an adequate size for your cat. It should be 1.5 times the length of your cat to ensure they can get in and out and have enough room to urinate. Ensure the trays have low size to allow easy access for your cat, and this is particularly important in our older arthritic animals. And once again, keep these in a nice and quiet location in the house. We also recommend you increase your cat's water intake. Many cats like running water, so trial water fountains or interactive water bowls. Switch to wet food, which has a higher water content, or you can try adding water to dry food. You can trial flavoured waters, such as boiling up some chicken and using the water for your cats to drink from in order to tempt them to drink if they're not a big drinker. But always remember to allow constant access to fresh water. There are also some supplements that can increase the health of the bladder that we can try. As I said before, male cats can become blocked as they have a narrower urethra than females. If your male cat is struggling to urinate or going to the litter box more frequently but not passing urine, this could be a sign that he is blocked. So get him to us as soon as possible. Other signs your male cat could be blocked include vomiting, lethargy, inappetence, collapse, or blood in urine. This is an emergency, and if not treated within 72 hours of your cat blocking, can result in death. So what happens if your cat is blocked? Once you have identified that your cat is blocked, our main aim is to relieve the blockage. We will take bloods from your cats to check how the cat's kidneys are coping with the blockage, and to check there are dangerously high levels of potassium which can affect your cat's heart. We will then place your cat on fluids, give him pain relief, and either sedate or anaesthetise him and place a urinary catheter and monitor the amount of urine produced. We then may carry out further diagnostics to determine the cause of the blockage. Your cat will need to be hospitalised for a few days and their urination monitored to ensure that they do not reblock. Thank you for listening to my presentation. So in summary, there are many causes of feline lower urinary tract disease, and we will try our best to rule out or rule in which one your kitty cat has. The main treatment we recommend is changing your cat's environment to control any flare-ups they may have. Male cats are more likely to be blocked, so please be vigilant and keep an eye on your male cat who may be struggling to urinate and get them to us as soon as possible. Thank you for listening. If you have any questions, do not hesitate to contact the clinic. Bye!